Good morning, friends. Welcome again. So let us practice more questions today. So the first question is: prolonged use of isoniazide leads to deficiency of first option niacin, B cyanocobalamin, C folic acid, D pyridoxine. So the right answer is pyridoxine. Isoniazid drug is used for the tuberculosis treatment. Next question. The clinical manifestation that are subjective is A. Sign, B. Symptoms, C. Disease, and D. Syndrome. So, as you can see in the question, the word subjective is used. So, always remember the answer is symptom. When we talk about objective, then it comes in signs, and the combination of sign and symptom is known as syndrome. Next question. If the nurse aide discovers fire in a client's room, the first thing to do. See the question, the word first is in the upper caps lock. So you can see clearly that all these things will be done, but what is the first thing to be done is asked clearly. So A, call the nurse in charge, B, remove the client, C, open windows, and D, call the healthcare provider. So the right answer is remove the client. Remember this mnemonic for the healthcare fire safety, that is RACE, RACE. R for rescue, it means the first rule of the nurse is to remove all the individuals from the vicinity of fire. A for alarm, it means to activate the fire alarm to extinguish fire. C confine, so whenever the fire is detected, so we have to close the door and windows. And the last is E extinguish, that is extinguish fire using the fire extinguisher. So the first rule is remove the client. Next question, Korsakoff of psychosis is due to intake of. Options are A. Cannabis, B. Opium, C. Amphetamine, and D. Alcohol. The right answer is alcohol. Korsakoff syndrome is a late complication of persistent Wernicke encephalopathy and results in memory deficiency, confusion, and behavioral change. Next question. Deficiency of thyroxine in adults lead to a condition called A. Tetany, B. Cretinism, C. Myxedema, and D. Graves' disease. So here they're asking about the hypothyroidism. Okay, so the condition is known as a myxedema. So it is the another term used for the severely advanced hypothyroidism. Next question. Diabetes insipidus is caused by deficiency of A. ADH, B. Insulin, C. Glucagon, and D. Renin. So the first question is, so as you can see, the question is diabetes insipidus. So the answer is ADH, that is antidiuretic hormone. If they are asking about the diabetes mellitus, then the answer will be insulin. Next question. Heavy proteinuria, hypoalbuminemia, and edema is characterized by A. Nephrotic syndrome, B. UTI, C. Acute glomerulonephritis, and D. Renal failure. So these three are the characteristics of the nephrotic syndrome. Eighth question. Main side effect of corticosteroid drug. A. Hair loss. B. Increased blood glucose level. C. Increased creatinine level. And D. Darkening of skin. So it is very important question. We all know that the main side effect of corticosteroid is increased blood sugar glucose level. Next question. Antidote of benzodiazepine. A. Lithium, B. Methadone, C. Flumazenil, and D. Chlorpromazine. So the right answer is flumazenil. Next, cystitis is the information of. So as we all know that itis means inflammation. So never confuse the word cystitis. So the options is gallbladder, urinary bladder, cyst, and liver. So the right answer is urinary bladder. So inflammation of urinary bladder is known as cystitis. So that's all for today. Please like, share, and subscribe my channel. And all the very best for your exams.